Hi, I'm Dr. Jason Loth with Nevi Health. Today I'm going to show you what it looks like to get a cervical adjustment done, and cervical means neck. So what we're going to do here, we're going to go through and like we did before is palpate the spine, feel how it moves, find where the restriction is, and give it an adjustment to that to actually free up scar tissue and lack of mobility. So as I come through here, the first thing I'm going to do is feel the mobility of the joints within the neck here. And I'm going to check both directions. I'm going to check to see how well it moves in all different mobility states, directions, side to side, and front to back, and rotationally. So with Stephanie, as I come through here, I find the restriction first off right over here. So this first adjustment I'm going to do is with her seated. Now what I want you to do, Stephanie, is hold your head right there for me. I'm going to come right under this joint, put a little bit of a tension to it, lean your head to the left for me, and just let your head fall right to that shoulder. Perfect. Now I'm going to get it right to a spot of tension and give just a little bit of an impulse to make it move better. How you doing there, okay, Stephanie? Mm-hmm. Okay, relax your head right into my hand and let me just hold it right down a little bit more. Perfect, just like that. So the goal is specificity, to get just the joint to move that's lacking motion. So after I adjust that, I'm going to recheck that mobility and see how it's moving. And that already moves quite a bit better when I recheck that motion. Now, turn to this side for me. When I feel over here on this left side, I also find a joint that's restricted. I'm going to adjust this joint with her laying on her back just to show you a different technique that we also use here at Nevi to adjust these joints. So Stephanie, if you could, right here for me, lay on your back, please. Yep. Okay, now same thing with this. I want you to relax your head for me, and you're going to turn right there. Now, I'm going to get a good firm contact on this, and nice and easy get this one joint to move. What I want you to do is relax your head right into my hand, and let me just hold it nice and easy right in that one joint. Just like that. Very good. Now go ahead and sit back up for me. So again, after I adjust the joint, I'll come back and recheck it to see the amount of mobility that we restored into that joint. As we start to work on these joints, again, our ultimate purpose is to get rid of pain or any other symptoms for that matter. Our second purpose is to restore the function of the joints and the muscles in here, and then we build strength around it, and then we maintain, and that's the key. A lot of people will have this dysfunction in their spine or in any other joint and have no symptoms from that. That dysfunction leads to arthritis, distress, and many other things down the road. So again, an ounce of prevention is worth a pound of cure. You know, we love that saying around here, is we like to keep things functional first and foremost. So there's an example of how I perform cervical adjustments, and I hope that helps give you some education in that.